Good afternoon. I also, I did not introduce myself yet. I'm Lynn Cardozo, she, her pronouns, and I am a member of the public and plan to apply to be a member of the standing committee.
And this is Jessica Bernard, Assistant Director of Quality Management for the Department of Mental Health. And I use she, her pronouns.
And this is Trish Singer, Department of Mental Health as well. She, her, I'm the Director of Adult Services. Unfortunately, I have to leave for 45 minutes from 12:15 to 1. So I'll be leaving shortly, but I'll be back at 1 p.m.
Thank you. Is there anyone else on the call? Okay. Well, welcome back, Vicki. It's great to have you, and welcome members of the public and DMH. One thing we like to check in about at the beginning of meetings is about participation from members of the public. Any committee members have any opinions about the possibility of waiving the restricted public comment period and making the meeting open to the public today?
Malika, can I make a comment? This is Dan.
Please.
My suggestion is we put this as a regular item on the agenda under SPSC, and every meeting we vote on it. But make it something we do every single time, and it's just a matter of course of business. So, for example, if we're interviewing, if we're meeting with a DA, that would probably be a day where we would not allow comment. So anyway, that's my proposal, and I would also suggest that we permit members of the public to make comments or ask questions throughout the meeting.
Thanks, Dan. Yeah, my understanding is that we had already agreed previously to check in about this at the beginning of each meeting, which is why I'm doing it now. Yeah, anyone opposed to the idea of, well, I guess that's a proposal. I guess we have to do Robert's rules, don't we? Any discussion about opening up public comment for the meeting?
I would move to open up public comments.
I second that.
Great. Great. All in favor?
Aye.
Aye.
Any opposed? Abstentions? Great.
So, Malika, thanks for reminding me that we had agreed to this. But could we add it to the agenda so it's on there, so people like me with a bad memory don't forget?
Hi, Dan. This is Eva.
I think that's
I'm going to add that to agendas going forward, so it will be there.
Thank you.
Thank you. Yeah, it is easy to forget. All right, so we need to look at the minutes. I think we're looking at May and June. Is that correct?
Correct.
Okay. Let's begin with May. Does anyone not have the minutes who needs to have them? Okay. It looks, the things that are in red, I don't know if it's Eva or Bert to explain what needs to be done with those.
Can you repeat the question, Malika?
Just there's some questions in red in the minutes now.
Right.
I don't know if those have been resolved or if those are what's the status there.
I feel rude and irresponsible. I don't remember right off the top of my head. I thought we were going to discuss it today. So, the heck.
No worries.
Any edits that need to happen, I have a notepad in front of me, so.
Okay.
The heck, huh?
When everyone's ready, Malika, I'd like to go through the minutes, including the things in red.
Yeah, can you say more about that?
Sure. First of all, I think we should go through and clarify the questions Bert had in red.
Yeah.
And secondly,
let's do that.
Yeah, and secondly, I do have some comments throughout the minutes. So, however you want to proceed. But
that seems fine to me. I feel bad because I was excessively thorough, and it seems like it's creating more work than should be. So.
Not at all, Bert. Not at all, Bert. These minutes
Okay.
are fantastic. Yeah.
Mm-hmm. I really appreciate your thoroughness.
The spirit of it was to have some sort of modality for us to be pretty clear about our intentions and the procedures we're using. We have to have credibility considering the public and all. So
yeah. So the first item in red, I do believe that I did chair that meeting. So that I think that should just read Dan Toll chaired the meeting.
Okay.
The second thing under April minutes, who motioned? Does anybody recall? I certainly don't. If not, I suggest we put a member motioned.
Mm-hmm.
Sounds good.
Okay.
Okay.
What does it matter who? I mean,
to me it doesn't.
Okay.
But
why don't I just say Dan Toll and Malika Puffer, as you both sort of spoke up in agreement to that?
I think in the May minutes it can just say member where it's review of the April minutes.
Okay.
Member motioned
to approve. Sure.
Where it says
I think that would be much better process than changing the notes after the fact. So sure.
Right.
Okay.
Yeah. Member motion, second member seconded, or whatever.
Okay.
If nobody has anything else, I have a comment on page 3.
Okay.
Okay.
Should I make my comment?
Go for it, Dan.
Yep.
Yeah, just take us through your comments and the red stuff.
Okay, I'll do that. So on page 3, starting with this, the agenda, the item that we're discussing here is this was the executive. No, wait a minute. This was the committee communication and facilitation, where we talked about strengths and needs to improve and how to achieve changes.
Mm-hmm.
There are a lot of good things that we said and agreed to here. And so starting with on page 3 with B, what do we need to improve? And then moving down to C on that same page, how do we achieve these changes? And flowing all the way through to page 4. I believe for this, and this is also a broader comment I'd like to make about how we operate, and this is just Dan Toll suggesting, but there are a lot of items in here that I think we want to implement, and I think we should be creating an open issues document so we capture the things, the follow-up items, that the important things that come up in the meetings, and track those so that things don't get lost in the shovel and we don't just, talk about them in one meeting and then never implement them.
You meaning more along the lines of like an action items list that
Yeah.
is,
Yeah, exactly,
Okay.
Bert. Yep, exactly. And that's not, my suggestion is not to be part of the minutes, but that to be a separate document. And if DMH can create and maintain that, that would be wonderful. I'm happy to help DMH create it. I would prefer not to be the maintainer, though.
I think that's a really good idea.
This is
Yeah,
Vicky.
Jim,
I
maybe we
don't-
could, I'll add that to the end of our agenda today to just check in about at the end what we might want to put on that list at the end of this meeting.
Perfect.
This is Vicky. I was wondering what the feasibility might be of having a shared Google Drive so that we could have access to that document and any other documents that we feel are relevant. Sometimes I have trouble going through attachments to previous emails, and that might be a more central way to communicate.
Mm-hmm.
Okay, I'll add that as well to what we'll discuss when we get to that point in the agenda. Thank you both for those suggestions.
Okay.
Thank you.
All right. Now, just to go back on page 3, under item C, the second paragraph, second sentence, just wanted to clarify that sentence. It says, an SPC member also stated goals for the SPC to engage productively in advising DMH in the redesignation process, as well as hopes for SPC to engage in advocacy.
What's your question about it, Dan?
I guess it's just not clear to me. Is it? Maybe it's just me, and so if it's clear to everybody else, then just move on.
should that be struck from the minutes though? Is it excessive detail? I wasn't meaning to.
No,
Okay.
not at all, Bert.
I was not meaning to editorialize, and a fair amount of this section was so. The hopes were to be very, to be very thorough about some of the disagreements that we've had or the
Yeah.
challenging conversations that we've had, so we can somehow move forward and be productive. So.
Right. No, there's no problem here at all, Bert,
Okay.
with what you've done, at least from my perspective. As stated.
Dan, the way that I understand that, which, correct me, anyone, if you have a different understanding, is that someone suggested a goal of having us have a more meaningful role in the redesignation process, and also to have more advocacy as part of our work. That's sort of how I'm reading that. I don't remember. Maybe I'm the one who said that. I have no idea. But that's sort of what I'm reading from it. And so I don't know if others have a different understanding, or if there's another way it can be worded to make that clear, if that is what it means.
No,
or maybe it's fine.
No, that makes sense to me, Malika. That helps. That definitely helps me understand. It makes sense to me now. Thank you.
Okay. So is that language acceptable? It's part of a discussion that we had.
I think I just add a verb after the second SPC. I think for the SPC is to engage.
Okay.
All right, moving along. Unless anybody has comments to page 5. The second row, the DMH discussion of COVID. First of all, the the item in red, I guess we need to clarify what should be reflected in the minutes here. My suggestion is, because we say the minutes are recorded right at the end, that we can probably strike this if everyone agrees.
Can you be more explicit about the specific language you wanted to strike?
Yeah, just the item that you put in red, that you put questions around.
Okay.
Yeah, I think because you so diligently put in the end that it's being recorded, that you can probably just take that whole sentence out. At least that's my suggestion.
Okay.
All right. So, Malika, I feel like I'm usurping your facilitating, but I'll forge ahead if you're comfortable with that. Okay. Well,
any other edits? I can finish these today and send them out to everyone.
Yeah, the next row below that, the other COVID discussion. I honestly don't remember what flyer I talked about, so I can't resend it because I don't have recollection of that. My suggestion is to, again, here, strike that unless somebody else can recall what the flyer was.
Remembering that being in reference to examples of teachers and throughout the state providing an outlet for students to use like Zoom or Skype to talk about activities that they've been engaged in even while the stay-at-home ban was on. Is that possible? That's what I'm remembering, but
that's very possible, but my memory is failing me on this one. I apologize to the committee.
Sorry, same here. My memory is a little bit in flux right now. So.
This is Malika. Can you all hear me?
Yeah.
Okay. Sorry, I got disconnected, but I'm back.
So I can strike that comment about the flyer as well, if that's what committee members think would be good.
I guess my suggestion is to do so unless anybody disagrees. Maybe that's a better way to. Excuse me?
Fine by me, Kate.
Okay. Thank you. On page 6, the last paragraph, again, here, this is another of the items in red. I think you've done a great job of capturing what we need in that section already, Bert. And my suggestion is just to strike the item in red, unless anybody disagrees.
Page 6. Can you be more discreet about?
Yeah. Page 6, the bottom paragraph. It's the section additional business listening session. And the wording is, quote, in chat box, ...
Right.
You got it?
Okay.
This is Malika. I believe what I put in the chat box, I also sent in an email, and I do think that detail is relevant to include. So I can find it in the emails if needed, or if someone already has it, you can just put it in there.
So what wording do you suggest, Malika? I'm fine with leaving it.
So I think just the wording isn't there. It just needs to be added. So, it could say, it made a motion that we move forward with the planning of a listening session with the goals of, and then the goals that were named.
Okay.
They're in emails.
And you can find and send those to Bert. Is that what I'm hearing?
I did do that already, but I can also dig those back up.
If that wouldn't be too much, I can just list the goals and make note of a motion having been made.
Yeah, I think it's important to list the goals, and I will find those and resend them.
Thank you. Thank you for being patient with me, everyone. I feel kind of unprofessional about all this.
No worries, Bert. Yeah, no worries, Bert. On page 7, the top of the second paragraph, an SVP mentions some statutory changes. And like Malika just said for the above item, if anybody can help Bert, I have no idea what those statutory changes are, and I think it's relevant. Just very in summary, what those statutory changes are.
So you're wanting a little more detail regarding what those changes were. I'm remembering that Malika had sent an email or something.
Yeah, I may have this also. I'm trying to find where you are, but what I recall is that I'd asked for DMH to inform us about relevant statutory changes, which didn't happen and has not happened yet. So I may have followed up by sending some information in email, but I don't know that it was shared during the meeting.
So what I'm hearing, Malika, is that a member mentioned some statutory changes that had happened before March 30th that were not reported to the committee. I'm adding that language, not reported to the committee. Is that what I'm hearing, Malika?
No, I've found them now. Yeah. So I think what is written there is accurate. I think I'd asked for DMH to share updates about statutory changes, and we didn't get those because we didn't really get updates and haven't for a couple months. But I knew that there were some that happened on March 30th, and it looks like I forwarded them to Eva, according to the minutes, who will send them out to SPSC. I don't know if that, I don't know if any of that happened, but it sounds like that's what was said. I don't have any changes to that. I don't think I talked specifically about what they were.
Okay. So you did send them, and there was an expressed interest in discussing them at this meeting.
I feel like that was under potential agenda items for the next meeting, right?
Yeah, those got shared from Malika and passed along to the rest of the committee. And then I don't think there was ever a check-in at a future meeting. There will be more statutory updates at this meeting, just so you know, from the leadership, DMH leadership.
Cool.
Okay.
It sounds to me like that piece of the minutes is accurate.
Right.
Okay.
Okay. That's it for me.
Great, thank you. And then the one last thing in red is double check accurate time. I think, whether it was a couple minutes before or after 3 p.m., that's probably close enough.
Sure. That was just maybe a leftover note for me to check the dictation that Eva had sent me.
Right.
So call it 3 o'clock even for adjournment. Was there a motion to adjourn? I don't remember if I listed.
Yes, it looks like you did.
Okay. All right. So I've taken notes on all of the suggestions that have come up. I will make those edits and resend the minutes to committee members by the end of the day today. It might not be until after the close of business, but certainly before my day is over, I will complete those edits and send them to the committee.
All right, thank you so much. And does anyone want to make a motion to approve these with the edits we just mentioned?
I'll move that the minutes be approved with the edits as mentioned. Kate.
Seconded, Dan.
All right, all in favor?
Aye.
Aye.
Great. Any opposed? Abstentions? All right, the minutes are approved with the changes. Let's move on to the June minutes.
And thank you everyone for being patient.
Yeah, thank you for your work.
I found them very good minutes, by the way.
Yes,
Thank you, Kate.
I agree, Bert.
Thank you also, Dan.
Yeah, these seem incredibly thorough. It must have taken a lot of work. Thank you.
It was an excessive amount of work. That's why I passed the task on to someone else. So.
I'm thinking I'm already intimidated for when it's my turn.
And it looks like Eva did the June minutes. Thank you, Eva. These were also sent out in email, so hopefully people have them. If not, speak up. Does anyone have any discussion on these minutes? I have one thing, which is that the DMH update, it wasn't my understanding that we were actually getting a formal DMH update from Tom, but rather that there wasn't a DMH update, and Tom sort of tried to answer some of the questions that we would have asked had there been one. Does anyone have a different understanding?
No, I concur, Malika. This is Dan.
Yeah, so I would suggest we change the minutes to reflect that and to include that there was no DMH update, but that we were able to ask some questions from Tom.
So I would be comfortable calling that an informal DMH update. I think, because there was a member of leadership there and he was able to give some detail, I would call that a DMH update. It just wasn't formally planned necessarily prior to the meeting. But I think it would be different if there was no member of leadership there able to update.
Yeah, but however, Iva, it's kind of glossing over the fact that we waited for the whole meeting for the update, and then Dr. Weigel was put in the uncomfortable position of having to do so.
So would you like me to call it an informal DMH update? Would that solve it?
I think maybe you could also include the part of the meeting that was us trying to figure out if we should keep waiting, just acknowledging the delay and the disruption.
Okay.
That's what I'm saying as well.
This is Vicki. I just know, having been a member of this committee for, about a year and a half, I guess. I've noticed kind of a trend towards more and more informal updates. I know I've asked as of a year ago if we could be notified of who would be giving the update or what general areas would be discussed so that we could, come up with questions. And we've kind of been told that that's not feasible. And I feel like kind of these surprise updates, not knowing when they're going to be or what's going to be discussed, really limits our ability as a committee to ask educated questions or receive timely responses. So I'm not sure that we can, I would oppose calling them informal updates because it doesn't seem that they're really serving the intended purpose. But that's my point of view. I'm just kind of volunteering there.
All right, so I'm hearing two different pieces of that. It sounds like the first piece is that we need to somehow note here that State Program Standing Committee members note that this update didn't happen at the planned time in the agenda, and that some statement about the kind of burden on committee members since it didn't happen as scheduled, kind of happened later than planned. And so I could add some sort of note to that and then send it out to members and see what you think about that. And we could do a vote on this at the next meeting if that's helpful. The second part of what I'm hearing you saying, Vicki, is that it would be helpful to know what the update would be about and, if possible, who would be delivering it. And that's something that DMH has talked about recently, is trying to have some sort of schedule and both let you see other members of the leadership teams so that you might hear from more than just commissioners, but you'd regularly hear from other folks that are also on the leadership team. That way you have the chance to hear some other topics that might be informative to your work. And also it would be helpful to know what broad topics are going to be covered in the update. And the topics for the update today are basically taken directly from member requests from the last month. And so if there are things that you specifically want to hear about and you can tell us, like in this meeting for next meeting, then we can work on preparing an update that reflects those requests. And if you don't have updates, then I can work on trying to ask leadership what topics they may be preparing an update about so that you could potentially know that the week before and have time to form questions or thoughts about them. Does that capture your thoughts?
Well, I appreciate you addressing that. This takes kind of understanding that we revisited.
No, you're breaking up, Vicky, at least to me. I missed that.
I'm sorry.
Oh, no worries.
Can you hear me okay?
Yeah, you're clear
Can
now.
you hear me okay right now? Okay, good. I won't move. But no, I really appreciate you addressing this. I feel like this is something that we've revisited several times. Maybe if it's unclear what constitutes an update, we could just create guidelines on what is and is not an update, and that would kind of address the issue more directly.
Yeah, if you have parameters that would be helpful that you would like to hear, then we are definitely always willing to listen to what you have to say and try to meet those needs as well as we can.
Great.
Could I ask a question?
Kate, yes.
Does the leadership team keep any kind of track of its doings and decisions? Are there internal documents that could be routinely forwarded to the standing committee members? Do they summarize what's going on to other people in the administration? It seems like this would be done regularly, because otherwise the burden is on standing committees to anticipate and know about things that they really don't. It shouldn't just be reactive. It should be an affirmative information sharing if they're to do their job.
And I just wanted to add to that. This is Vicki. Given that we're discussing that this is an informal update, one of those subpoints being SPSC members stated their preference that funding go to prevention and community resources instead of any inpatient or secure residential beds. It seems like if we're giving our recommendations as a committee and those are being conveyed via a subpoint in an informal update in minutes, it would be nice to have more organization so that, it seems like the purpose of our committee is to give feedback. So we need maybe a path to communicate that feedback. So maybe, kind of elucidating some of this.
Yeah, and I think the way that this update happened is an anomaly. It's not the norm. We try to have a planned update. We try to have it be formal and be prepared beforehand. And this month it just didn't work out well. But
why not
we're
just
trying to
call it why not just call it an impromptu update, since that's what it was? It's not editorializing.
Impromptu update?
Yeah, it's impromptu. But also, I have a question concerning the minutes, only because I'm not questioning what's stated is accurate. I'm saying that I can't make head or tail of what it actually means, and that has to do with the listening session. And looking at the June minutes, what is the progress on that? And if not, why not?
We'll have an update about that today, and that's one of our agenda items.
Okay, I hope it will cover what kind of support DMH is giving to this initiative, since I don't expect the standing committee would be able to just do it on its own.
Yeah,
Yeah,
You,
I think
you
it's great.
all excellent points, Kate.
I think that's Lynn, maybe.
Or
No, it's
what?
actually Laura.
Oh,
Oh,
Laura.
sorry.
Sorry.
It's all right. You can call me whatever you like.
Okay.
Yeah, okay, so it sounds like some of these things are changes to the minutes and that Eva will draft up some alternative language and send it out to the committee for review. And some of these things are important, broader topics about our process and relationship with DMH, so I'm also making note of those things so that we can sort of keep that discussion going beyond just the minute review as well. Are there any other comments on the minutes themselves?
Yes.
This is Vicki. Sorry, go ahead, Dan.
No, go ahead, Vicki.
I just wanted to clarify to Eva that I kind of object to the committee's recommendations being put as a sub bullet under a DMH update. I think it would be nice to have those in the minutes, but maybe not. I don't see them necessarily fitting as part of a DMH update.
Are those the two, Vicki? Are those the two items that are not black at the bottom?
Yes, that's right.
Okay. Yeah, I had that same question. I wasn't sure why they were different colors and why it was there.
If perhaps they could be sort of in their own section.
Yep.
You can do that. Make it like a response to DMH update box.
Yeah, response or recommendations.
Yeah.
Something like that.
And do you have more, Vicki?
No, that was all. Thank you.
Okay. Just a couple little nits.
Yep, go ahead.
In that same box, DVHA, could you spell that out?
Absolutely.
As you did with Middlesex, yeah. And then the fourth bullet down, I think there's a typo there. I think it should read Wyndham Center set up as.
Wyndham Center set up as. Yep, you're right. Fixed. Anything else?
This is Lynn Cardozo, and I just have a small thing. So down in the public comment section, that was me that had mentioned that if I had had an opportunity to ask Dr. Weigel a question, it would have been with regard to physical distancing. And but really, what I was referring to was the question was more about what accommodations are being made for people who are either in a facility, hospital setting, any kind of setting that's a congregate setting, for people who have mental and physical disabilities. There is a lot of assumptions and generalizations out there that that these people, can't necessarily follow CDC recommendations for safety. So my question was really about accommodations, and just that word could be entered as an edit. But it didn't necessarily have to do with anybody that had tested positive for COVID-19. This is really about the safety recommendations that have been made for people to have their best opportunity to be protected and safe. So what accommodations are being made for the people who are, at this point, being assumed as people who, can't physically distance or can't. I'm very concerned about that. There's a lot of general assumptions about groups of people, sort of herd mentality, as to who can and who can't understand the concepts of safety amidst this pandemic.
Sorry, I misunderstood.
That was the whole thing but, if you wanted to make an edit to this, it could just say, what accommodations for physically distancing are being offered to people with mental and physical disabilities. You know, and it could say in congregate settings, but it's not just that, it's everywhere. Anyway, I just wanted to clarify what you know, whether there's any change to the minutes or not. I did want to clarify my point to the group because I think it's important.
I'm going to update that to reflect what you said for the minutes, because I don't want it to be captured incorrectly.
Perfect.
Awesome. Any other comments on the June minutes?
Just one last little nit at the very end under closing meetings for closing meeting business. The sentence says, future agenda topic to have information about the history of the committee history of the committee's main task. I would just strike of the and put and its. So it's history of the committee's history and its main task. So the committee's strike of the committees.
Gotcha.
Thank you, Eva, for doing those. I really appreciate this.
No problem.
Okay, great. So we will, I think it makes sense to review these edits at the next meeting. Maybe we'll have a chance to look at it before then, or I imagine we will. And we have now on our agenda a 10-minute break. And maybe you could just tell us really quickly, Eva, I know you may have already done this, but who is giving the DMH update at 1, and broad strokes, what are the topics, just so people can have that in mind during break?
Yep. As far as I know, it's going to be Commissioner Squirrel who will be giving the update, and that was still true as of an hour ago, so let's hope that hasn't changed. The big topics, it looks like any statutory changes that affect DMH or DAs in the last session, what DMH is doing regarding racial disparities and promoting equity and inclusion, and access to technology for mental health patients. There are 3 broad things.
Awesome. Thank you so much. So we'll take a 10-minute break now and be back at about 1.
Great.
Okay. Thanks, Micah.
Hi, it's Tom Weigel joining from DMH.
Welcome,
Hi.
Tom.
Hello.
It's Trish rejoining.
Welcome, Trish.
Can you all hear me? This is Dan.
Yes.
Yes.
Okay, I just switched devices.
Okay, we should probably get started. Is Sarah on the call?
I think the commissioner's planning to attend, when last I heard.
Maybe we should get everyone to just state their name so we know who's on the call.
Dan Toll.
Vicki Warfield.
Ward Nile.
Kate Hunt.
Malika Puffer.
Tom Weigel.
Eva Down, DMH.
Singer
Jessica
DMH.
Bernard, DMH.
Bert
Okay, I
Dyer.
didn't hear the. There were two people I didn't hear, right before Bert and right before Eva.
This is Jessica Bernard. I went after Eva, but I think Trish and I tried to talk at the same time.
Yep, sorry about that. This is Trish.
Was there somebody named Michael?
Ward Nile is a new member.
Sorry about that word.
Members of the public on the call? All right, Sarah is here. If we want to continue check-in or move forward with the update, that's up to you, members of the committee.
Let's move forward with the DMH update.
Is that my cue?
Yes, when you're ready.
Okay, thank you. Good afternoon, everyone. This is Sarah Squirrel, Commissioner of the Department of Mental Health. It is wonderful to see everyone. Thank you for letting me have a few minutes to chat with everyone. There is certainly a lot happening in our mental health system of care. I'm very appreciative of the great work and commitment of the Adult State Standing Committee. Thank you very, very much. So I did prepare some overview items that I thought would be of interest to the Adult State Standing Committee in terms of things that are currently happening in the system of care, some of the areas that we're really focusing on, and then of course wanted to leave a little bit of time for any questions that folks might have. So I will just jump right in if that's okay with folks, but I'll look for some nod of approval to do that. Great, I see a thumbs up, thank you. So obviously the impact of COVID-19 has been significant on our entire human service system across the state. One of the first things that the department really focused on was stabilizing our critical healthcare providers. And for us, that would be our network of community mental health agencies are essential. And when COVID-19 first impacted the state, obviously the provision of services shifted significantly. Our community mental health agencies and other organizations have had to grapple with staffing shortages and changes, given that individuals, of course, have to be home to care for their children or to attend to their own health needs. So across the system, we saw an immediate destabilization, if you will. So we worked very hard to try to ensure that that system was stabilized. We put into place several items. I think I briefed this committee about those previously. We were able to articulate and advocate for additional funding to the community mental health agencies related to hazard pay so that they could continue to have staff coming in who are doing face-to-face work, et cetera. We also were able to put into place additional relief for them. So if they had other expenses incurred due to the impact of COVID-19, then they were able to apply for CRF funding that we were able to provide. All in all, between March and the end of June, we provided just over $10 million to our community mental health designated agencies and specialized service agencies. I will segue into a little bit of an update to this group related to the next tranche of funds related to healthcare stabilization, which I'm sure you're all very interested in. As you know, the legislature approved, I believe it was $350 million for the Agency of Human Services to move forward for additional healthcare stabilization relief. That is open to all healthcare providers. So we were able to move quickly to stabilize our DAs and SSAs, which I know that's fully under the purview of the Adult State Standing Committee. So I'm sure you're glad to hear we were able to support them. Other organizations will also be able to apply for that funding. That includes peer organizations, recovery organizations, et cetera, which I also think will be essential. The Agency of Human Services is working on that application process now. What we're contemplating right now is kind of a two-phased approach. So the first phase will be essentially March through, I believe it's mid-May. Providers can apply for CRF funds. This could be lost revenue. This could be additional COVID expenses that they're taking on related to PPE, any other COVID related expenses they can apply for. AHS is currently working on building the actual application itself. We are trying to move towards a uniform application so that all providers are providing the same amount of information. We also really need to ensure that we have the right documentation to ensure audit compliance. We want to make sure that these funds are kind of purpose restricted, if you will, meaning for coronavirus relief responses. So we really want to make sure we have a well-organized application process. There will then be a second phase that will happen between, I guess, essentially mid-June through end of September. There will be another opportunity for providers to apply for healthcare stabilization relief. Because we were able to move so quickly to support the designated agencies and specialized service agencies, we actually think their next most vulnerable area is going to be that kind of July through September period. Also, you might be wondering, what if the demand exceeds what we have available in that first round of funding? And so we have contemplated ensuring that if it looks like the applications are going to hit or reach the full allotment of funding, that the Agency of Human Services can actually hold back some funds to ensure that we have funding for that second phase. Because I do think a lot about the designated community mental health agencies and specialized service agencies, and wanting to ensure that there are stabilization funds that are available at the end of September to meet those needs. One area that I will just highlight for the Adult State Standing Committee that I think is a little bit of a risk area for us as a system of care is related to school-based mental health. So we have really reaped the benefits of implementing payment reform for our designated agencies and specialized service agencies. They receive a prospective monthly case rate. So we are able to essentially provide them with the same amount of funding, and we can adjust utilization and quality review on the back end to ensure that while COVID has impacted how and the volume of services that are provided, we can adjust for that. School-based mental health remains outside of the case rate. And so part of that school-based mental health provision was a fee-for-service model. We at DMH immediately implemented an emergency case rate because we wanted to ensure that we could maintain the capacity of our school-based mental health providers. We know that there are many vulnerable children and youth the pivot to remote learning has actually just increased the need. We know many children and youth, particularly the most vulnerable, school is where they access some of their most nourishing and stable relationships. So we wanted to make sure we could still bridge that, and also to maintain the capacity of our designated agencies who are providing most of the school-based mental health services. What we did not anticipate was that many of the local education agencies, the LEAs, the local schools, they provide the match funding to draw down our mental health Medicaid. And our mental health Medicaid has a lot of flexibility built into it. That's kind of the direction of payment reform that the healthcare system is moving in. Many of the local schools started to push back a little bit and say, whoa, services are being provided differently. They're not being provided in our public schools anymore. Therefore, we are going to stay in a fee-for-service model, and we're not going to pay for these services being provided differently. So that created a little bit of tension between DMH really leaning into, let's ensure we have this capacity, local schools then saying, we don't want to pay for this because it looks and feels different. And so I've been working very hard with Secretary French at the Agency of Education, as well as with the DAs and LEAs and superintendents to try to recalibrate, come back together as systems partners, and come up with a plan for how we move forward so that we can ensure the continuation of school-based mental health services into the future. We are preparing for schools to reopen.
Commissioner, may I interrupt you and just ask that you focus on things related to adult mental health for now?
Sure, no problem. I just thought it would be important to know that for school-based mental health, it is actually a big part of their revenue streams for the designated agencies. So if school-based mental health, and they actually utilize some of the revenue from those programs to support other programming. So if the school-based mental health services are destabilized, that will have a significant destabilizing effect on the overall fiscal health of the DAs. And I can just leave it at that. And anyone who has more or would like more information on that, I'm happy to share it. So thank you for that reminder. I'll pause there and just shift a little bit to some of the mental health awareness and suicide prevention work that we are focusing on. We are really monitoring suicide data across the state of Vermont. We did see an uptick in May, and suicide deaths in May were higher than previous years. We are currently seeing a decrease in June and are back under that. We use a five-year year-to-date average. We have also seen, we have really invested in the state in the utilization of the National Suicide Prevention Lifeline and the Crisis Text Line. We have seen an increase in utilization of both of those services and supports. Isolation, suicidal ideation, and depression were certainly the primary issues for those that have been seeking help. We are starting to see a little bit of a decrease in the utilization of those two resources in June. So again, that's something that we're monitoring very closely. We have several PSAs that are out across the state just to encourage folks to take care of their own mental health, to know that there is help available if they need it. We are anxiously awaiting the announcement of whether we're going to receive the suicide prevention grant from SAMHSA. We were told we were going to hear at the end of June. We have not yet. The legislature has appropriated $800,000 to the Department of Mental Health for suicide prevention work if we are not a successful recipient of that grant. We also have a crisis counseling grant that we can talk more about, and a SAMHSA mental health grant that is focused on expanding some of our emergency services as well as peer services as well. So going back, I do want to shift back to healthcare stabilization just very quickly, because in addition to our designated agencies, which I know is kind of what is the purview of this group, I do want to talk a little bit about the Brattleboro Retreat and some of the support that we've been offering them, just so that this, the Adult State Standing Committee is aware. As we know, the Brattleboro Retreat is one of our largest providers of inpatient capacity in the state of Vermont for adults. Prior to the impact of COVID-19, the Brattleboro Retreat was on shaky fiscal ground. We, as an agency, put together a slate of rate increases to attempt to help stabilize them. Of course, the impact of COVID had an immediate effect on them, staffing, census, et cetera. So we did propose to the legislature an interim funding proposal, as well as a sustainability and action plan. We really need a path forward with the Brattleboro Retreat to get them on a path to sustainability and stability. So the interim funding proposal was also attached to an action plan. The continued ability of them to receive those funds is directly connected to making material progress on the action plan. The original slate of funding to the Brattleboro Retreat was $10.2 million. Between June and the end of September. I will apprise this committee that there was some additional financial information that the Brattleboro Retreat provided to the Agency of Human Services. So we've actually adjusted down the payment provisions a bit based on that new information. So right now, the total package that they will receive is $7.6 million between now and the end of September. I'm happy to share the details of that action plan, our public documents. I testified on it extensively when the legislature was in session. But if this group would like more information or would like to see that packet of information, I'm happy to share it. With that provision of funding came a whole slate of additional quality measures, oversight measures, and the implementation of the sustainability plan that we're also working on in good faith with the Brattleboro retreat as we speak. Other areas in the system of care, the impact of COVID, certainly we saw an immediate kind of lessening of individuals who were presenting in emergency departments for inpatient care. We can think there are a lot of reasons that probably contributed to that. Number one was just folks, kind of sheltering in place, the courts, kind of shutting down essentially, not as many face-to-face services being provided in the communities. So we really did see a significant slowing down of individuals presenting for inpatient care. We are starting to see those numbers increase again. We're starting to see more individuals who are presenting in emergency departments. And of course, we want to continue to focus on how do we strengthen community peer services to divert individuals from needing to go into the EDs in the first place. At the same time, ensuring we have adequate high quality inpatient capacity that folks can access. And then of course, ensuring that we have the appropriate step down capacity for individuals who are ready to step down to a lower level, community level of care. One of the other areas that we were worried about right from the beginning was what capacity do we have for COVID positive individuals who might be presenting in an emergency department. So we did work very hard as a team to try to identify where we could create that capacity. Over the past few months, we've been working very closely with Springfield Hospital and the Wyndham Center. So the Wyndham Center was identified as a unit that could be utilized for COVID positive patients. We wanted to make sure that if a patient was COVID positive, they still had access to timely and appropriate mental health care and treatment. I have to say Springfield Hospital has been incredibly collaborative partners with the department. So they are probably a couple weeks away from some construction updates being finalized to the Wyndham Center. We were able to use some FEMA dollars and CRF dollars to actually invest in the Wyndham Center to improve it from a safety capacity, from a clinical capacity. And that unit will be fully up and running, I think, in the next couple of weeks. And in the short term, Springfield has also made available 2 additional beds for individuals who are currently presenting and are tested COVID positive. We have had a couple of cases where individuals were COVID positive, have received treatment at that kind of alternate inpatient facility and have subsequently transitioned back to another inpatient setting. So we've already seen that capacity in the system work successfully. I will just let this group know that another area that I am a little bit worried about right now is individuals who are presenting in emergency departments who are refusing COVID testing, which is perfectly understandable. That an individual who might be presenting or be experiencing a psychiatric crisis may not be comfortable having a COVID test. However, that does make admission into an inpatient unit a bit more challenging. So that is another area that we at the department are continuing to focus on in terms of additional capacity and working with individuals in the EDs with their, trusted individuals in their lives to ensure that they don't experience prolonged wait times. I think overall, in terms of capacity in the system, we're still running a little bit under capacity and where we would like to be. Many of our facilities are still experiencing staffing shortages or challenges with recruitment. So those are things that we are keeping an eye on. We hope that our capacity in the system will continue to recalibrate and re-strengthen. And then, of course, always wanting to focus on community-based services and peer services to try to meet people's needs in the community as much as possible. So I think those are some of the high-level updates that I wanted to make sure that this group had. And I think what I will do is just pause there, see if there is anything that I missed that felt urgent and important from the Adult State Standing Committee's perspective, or any questions that you might have for me.
Thanks for all that info, Sarah. Those weren't the topics that we were expecting to hear updates about. Did you have updates about any of the topics that we'd requested updates on?
I believe that other members of the DMH team were prepared to provide other updates that were aligned with your specific requests, but I could be wrong. I'm looking at Dr. Weigel, but I thought that list of requests had gone to other members of the DMH team.
Yes, I'm happy to talk about that. If you, I don't know if you want to stay on for that, or if you want to answer questions, Commissioner, about some of the content that you've discussed already.
Yeah, people, if we're going to get other updates, I guess people may have questions about what you've shared.
I do. This is Kate. I do have a couple of questions for the Commissioner.
Great. That'd be wonderful. Yeah, great.
I'll just rattle them off.
Sure.
Okay. First of all, I'm wondering regarding the school-based mental health topic that you began with. I am curious about the timetable where you see that might sort of be worked out or resolved, or you might have a better handle on whether those concerns that you alluded to but didn't, you said I'll table them for now. I'm curious if you could sort of, at a high level, tell us what those concerns specifically might be and when you think you might have a grip on whether they are going to materialize or not. That's question one. Question two, I'm wondering, I'm not sure if I heard you correctly, if I heard you completely, but when you were saying that people were starting to go to the ED a bit more now in greater numbers, I think you said something about you're trying to do more to divert them from the emergency department. If I heard that right, I'm curious what that is. And my last question is, I'm wondering if COVID has caused inpatient facilities to at all alter their treatment protocols in order to reduce length of stay simply due to COVID. Those are my questions. Thank you in advance.
Yes, all great questions. I'll start from the top. So school-based mental health, I think my biggest worry is that if we can't create some common understanding around flexibility and how the provision of services is going to look different, that will have an impact on what services the schools are willing to pay for, which will then have a direct impact on the designated community mental health agencies and their finances and their ability to maintain the cadre of incredibly well-trained staff that they have. So what we're working on right now is trying to go into the school year with some understanding of how IEPs could be written more flexibly, how services can be provided in a remote learning environment, and have all parties agree and understand, which would then allow us to, I think, mediate what we just had happen, which felt like a little bit of a crisis in the moment because the local schools were not completely aligned with the flexibility that we have to continue those services. So I think the critical point is actually between now and when school starts. And we had a working group session this morning where we've got the Agency of Education, DMH, LEA, superintendents, all trying to come together around this. The Secretary of the Agency of Education is very committed to ensuring that we figure this out. Related to continuing to look at community-based services, I think what I was trying to articulate is that as much as we're focusing on inpatient and ensuring we have adequate inpatient capacity, also focusing on our community-based capacity, ensuring that our designated community mental health agencies, our peer services, that we're supporting them in coming online as well, because that's really critical to supporting folks at the community level so that they don't need to access a higher level of care. In terms of COVID treatment protocols, I think that, probably the basic fundamental kind of approach is that, how long you're in an inpatient setting is, certainly driven by what your clinical treatment needs are and care needs are. I haven't heard anything in terms of change of practice there, but obviously in all times, under all circumstances, we want individuals in the least restrictive setting possible as soon as possible. And also wanting to ensure that people are getting the adequate care and treatment that they need as part of their recovery.
Thank you.
Of course.
I think maybe just to add on to the inpatient question, that I think as was mentioned, that patients are being tested for COVID and need to have a result of negative before they're transitioned into an inpatient unit. And then, some of the units have decompressed, meaning they've eliminated some of their double rooms and transitioned them to single rooms, and are offering masks and things like that. So I think that there's other things that they're doing in response to COVID to try to make sure people are safe.
Thanks.
Just a comment, Sarah.
Yes, of course.
Just, from my personal perspective, just kudos to your comments about focusing on community-based and peer support services over inpatient, higher cost, more invasive services. So that's great to hear.
And to Malika's, oh, sorry, go ahead.
I have two questions, if that's all right.
Sure.
Okay, my first question is, what steps has DMH taken to fulfill their statutory obligation to provide patients with information regarding their legal rights and access to patient reps, given that all the patient reps were furloughed at the time of the outbreak and currently advocates aren't able to access patients due to the quarantining and safety precautions around the pandemic?
So are you referring to folks from Vermont Psychiatric Survivors who are able to provide support in the inpatient settings and legal aid?
Whoever you guys are contracting with to fulfill the patient representative role.
Yeah, Trish, do you want to speak to it? It's my understanding that there was information that was posted that I believe this was a question that came up before, and we had provided some information on our efforts there, but I could be wrong.
Yeah, no, and I'll have to look at my notes to be sure, but yes, I've had numerous conversations with Vermont Psychiatric Survivors. They have continued to have a presence in all of the hospitals via remote communication. They've also been, we've had a letter from the retreat where they've talked about some of the new communication mechanisms to ensure that in fact the patients have access to patient reps as needed. So we have had conversations around that, and all the hospitals have had contact with Vermont Psychiatric Survivor patient reps to ensure that in fact the inpatients feel that they have to get that communication, that. So there's specifically an area that you're concerned about, Vicki?
I'd like a little more information about what the access, what kind of communication that was. My understanding is that the patient reps were furloughed, so I'm wondering what patient reps, like how many paid patient reps are currently offering.
So, in fact, at one point I had an email which listed all of the staff and which hospitals they went to, and then they have certain days in which they have standing commitments, and then they also make additional appointments as needed depending on a particular individual's needs. So I can go back and look at that email. I don't have it in front of me. But yeah, they have had those arrangements with all of the hospitals that they represent.
Yeah, I'd just really like to know what the arrangements are and how many staff are currently paid to provide the services and how many hours are involved dedicated to that representation.
Okay.
Yeah, and this is Malika. The only person I'm aware of who I've heard of doing any of that is Topher himself, who cannot possibly have that capacity to do all of that work in addition of his other responsibilities.
I don't believe there's any training on that either. There's no one providing training for the patient rep role as that I'm aware of.
So I will go back and look at that email conversation that I had with Topher a few months ago and review that, and I can update the committee next time.
Thank you. Oh, and my
this is Dan.
Question,
this is Dan.
I think Vicki had one other question.
Yeah, thank you. My last question is somewhat simpler. It's for Commissioner Squirrel. You were talking about the two-phase process for awarding the $10 million in COVID-related funds. And I got a little confused when you were talking about the first phase versus the second phase. It sounds like phase 2 started last month and goes until September, and that's the second phase of awarding funds. But it sounded like you guys are still in development of the application. Can you just clarify a little bit more what the process and time frame is for the two phases and the difference between them?
Yeah, sure, no problem. So the healthcare stabilization funding was just approved by the legislature. I believe it was $350 million. That's all healthcare providers. Phase 1 will be a look back. So what that means is that all of our healthcare providers can look back between March and mid-June, I believe is the time frame, and they can submit an application for any COVID-related expenses, lost revenue, etc. That's the first phase where they can apply for funds for that time period. That application will hopefully be up and running in the next few weeks. And that will be evaluated by folks at the Agency of Human Services, and then the funds will be deployed, I guess, in the next month or so. Phase 2, you will be able to apply, I believe, in mid-October, and that will be for the period of June 15th to September 30th. So that's phase 2. So one of the key things with the CRF funds, the Agency of Human Services has contracted with an entity called Guidehouse that is working with folks nationally, because we want to make sure that we're ticking all the audit boxes, is that you cannot use CRF dollars for anticipated expenses. They have to be for known impacts of COVID, which is why we will have the two phases, because right now providers can let us know what their impact was for that first phase, March through mid-June. Phase 2 will be mid-June through end of September. And if there's money left over, that you could contemplate a phase 3, but we'd be running pretty close to that December 30th deadline for the funds being expended. So I hope that's more clear. I apologize if I wasn't clear before.
Really clear as well. Thank you. I appreciate it.
Yeah.
This is Dan. Another clarification question, Sarah. You were talking about after a little bit later about money coming from SAMHSA in different buckets. And I believe you said there's a SAMHSA suicide prevention grant was one bucket, and then a second bucket, a COVID-19. Can you just clarify, and there may be a third or fourth bucket. Can you first just at a high level summarize what the money is from SAMHSA, what the categories are and what they're for?
Yes, great question. And maybe we could outline this for you in a document to make it more clear, or at least give you some bullet points. I apologize. It's a lot to process what I'm saying and not have the information in front of you.
You're working with an incredible amount of detail, so no worries.
Thank you. So we've applied. There have been several opportunities through SAMHSA for funding that DMH has applied for. The first was the crisis counseling grant, which is actually FEMA dollars, I believe. I believe Deputy Commissioner Morning Fox has joined us. He can correct me if I'm wrong. And that really supports community-based outreach by training kind of local individuals to conduct needs assessments, to identify severe emotional distress in the community. And we partner with the designated agencies to implement that grant. We also have a SAMHSA mental health grant. It was a mental health / substance use grant that we received. I believe we got just under $1 million. There's a whole slate of areas that we'll be focusing on, from expanding emergency services to expanding peer services. I believe we have a one-pager on that we could send to the Adult State Standing Committee so you could see that. And then the third SAMHSA opportunity was the suicide prevention grant. That application opened up, I believe, about a month ago. We applied immediately to support the continued expansion of our suicide prevention efforts in Vermont. And we have not heard back yet if we are a successful recipient as a state. However, the legislature also allocated funding for suicide prevention efforts. So if we're not successful in receiving the SAMHSA grant, there was $800,000 that was earmarked for suicide prevention work as well.
Okay. So I may be wrong with my numbers, so apologize, but my understanding was that the SAMHSA mental health substance use grant was $2 million. And of that $2 million, 1.8 went towards substance use disorder issues, leaving 200,000 left for everything else. And of that, some of that went to the support line, some of that went for a mobile crisis van, which left approximately 60,000 for peer support services.
Hi, this is Jeff Bernard.
I guess my question is, there are what? Well, if I can just finish my question or my point, I'd like your perspective about why so much of that 2 million or 1 million, whatever it was, if I've got the numbers wrong, was going towards substance use issues and so little to everything else. Because there are other buckets of funding going into that into the former category, and it just seems like there's so much money flowing into the former and so much less proportionally into the latter. I hope that question made sense, Sarah.
Yeah, it does, and I think Jess Bernard was probably going to clarify. I believe we received just under $1 million.
We actually got 1.1. SAMHSA was very, EDAP was very generous and let us have just a little bit more than half.
And so, Dan, I think what would be helpful, we can send the breakdown of how those were proposing to utilize those SAMHSA funds. But we did receive $1.1 million of the $2 million.
And most of it did go to substance use related issues. Am I correct about that?
Of the mental health dollars that we received, the 1.1?
Right.
No, that's not my understanding. And I think that's where we could, Jess, maybe we could send, I believe Cheryl has an overview of that we could send to the Adult State Standing Committee that might help clarify.
Yes, absolutely.
Great. Thank you, Dan. Great question. I do have to get on a call with a legislator at 1:45. I want to make sure, to Malika's good points, that there were questions that were sent to the department in advance. I know Dr. Tom Weigel and others have been working to craft responses to those. So I want to make sure that we have a chance to speak to those, but want to see if there's other questions for me before I have to hop off. Okay. Well, certainly sometimes I do my best thinking reflectively. So if there are additional questions for me, please let me know. Send me an email. I think my team is prepared with other updates for you on other things that are happening in the system of care. Certainly, we're all continuing to grapple with the impact of COVID. Always open to ideas and thinking about how we continue to strengthen and improve the system. And strengthen and improve collaboration and communication with the department. So please reach out if there's anything else that you want me to be aware of.
Thank you, Sarah.
Okay, great. All right. Thank you, everyone.
Take care.
Take care.
Sure. This is Tom. Why don't I try to address some of the other questions that I think were brought up for topics of discussion. I think one was around racial disparities and what DMH is doing to address racial disparities and promote equity and inclusion. I think DMH has been concerned about racial justice and other equity issues. In fact, in the Vision 2030 10-year plan, it did include many goals and objectives related to racial justice and other forms of inequalities. DMH has recently adopted a racial justice statement that's posted on our website. In addition, there's about 20 DMH staff members who are meeting twice a month to look at resources that address some of the inequities, both systemic and structural in nature, in both Vermont and in the U.S. And we'll be using the adopted racial justice statement to guide our work and connect with partners to make sure that the mental health system of care in Vermont works continuously to identify and eliminate racism and to make things equitable. So in addition to that, the Vermont Psychiatric Care Hospital has adopted its own racial justice statement. That's also posted on the website. And VPCH has been working with Greg Hessel and a consultant over the last year focused on workplace inclusion. And staff are participating in 2 rounds of mandatory half-day trainings, and leadership is participating in workshops to promote a healthier and more inclusive work environment. And then I think there was a question around, is DMH promoting defunding the police? And I think the governor had made a statement in June. He said that his administration is already pursuing changes in the way policing is done in Vermont, including putting mental health counselors in state police barracks and investing in after-school programs, but that he did not support reallocating funds from law enforcement to pay for those endeavors. I think the last 2 meetings we've had, there questions came up around access to technology for mental health services. And as far as the designated agencies are concerned, DMH submitted and was approved for a grant from the Vermont Community Foundation to supplement the DA's and SSA networks to fund technology purchases for clients and to support telehealth. And also looking at other federal grants that will assist with technology for staff at the DAs and SSAs. And this, I think the grant of $100,000 is going to be provided directly to the network as unrestricted funds. And then on the inpatient units, I was in contact with each of the inpatient units, and they all have unit computers, unit telephones, where patients are able to access email and social media and communicate with family members, supports, and advocates. And there have not been any reports or complaints of inadequate technology access as far as that was concerned.
I have a question about that, Tom, which is on those inpatient units, are those just like shared devices, or are people able to have their own devices? And if they're shared devices, are people able to use them in a private space with no staff present so that they can speak confidentially to advocates?
Yes, so I knew that was a question or concern, so I did follow up to make sure that each unit did answer that question, and each unit did have the ability to have private and confidential use of that equipment for meetings. So I did specifically follow up on that. And so, as far as people using their own devices, some units permit that and some units don't. But all units did have access to computers and telephones for private communications.
Tom, this is Dan. Did they talk about how effectively those public available devices were working. I can give you some feedback anecdotally. I do 2 groups a month, peer support groups at VPCH, and there are issues right now for patients accessing the public computers there because they're going through a software change. So there's a frustration level with their ability to access the technology. It may be there, but it's not usable right now.
If you want to, I can be in contact with them about that particular issue. I do know that they, I don't remember the specifics. I think they went from something like Net Nanny to a different program, and I don't know if they had some glitches, but I thought that that was working better now.
Yeah.
Yeah,
Appreciate anything further.
Yeah, I can follow up with that.
And did you get any information on like what private use looks like? Because what I'd heard described previously was like staff holding devices for patients. Can you just give us a picture of how people are accessing things privately?
You know, when of the units that did not allow people to have their own personal devices, I followed up with the question of whether patients were able to access the computers and or provided tablets privately and without staff supervision for confidential discussions with, you know, peers, advocates, families, et cetera, and they all said yes. So I other than, like, I don't know, I don't have an exact picture of how that happens, but I was given that information or confirmation that does and can happen.
Okay, that might be good to look into. I think essentially what we're talking about is a little bit of like a quality check or review and accountability for something that's really, really important. I think this committee has really been consistent and unanimous in saying this is really important. And so I think an effective quality check on that would I think the next step anyway is to go beyond just asking, are you doing this thing, yes or no, but to have a better picture of what that looks like. If that's possible, that would be much appreciated.
Well, was there, I mean, I do have a deeper dive, but was there a particular facility you had concerns about, or I can walk through the, I mean, they all answer similar questions in similar ways, you know.
Well, my question was, what does it mean? What does it look like to have private and confidential access? And it sounds like they didn't give you an answer to that question, which is fine, but maybe we can go back and get that answer, because it conflicts with reports that I've heard, but maybe it's true. Maybe they've made those changes, but it would be great to know more specifically what that means to them.
Sure. I mean,
it could be that we're operating off of different ideas of what private means.
If it's helpful, I can say that, you know, within the last 6 months or 7 months, when I was a patient rep at the Brattleboro retreat, I know that confidential communication was considered use of a public phone that was, you know, bolted to a hallway in each of the units. And if I tried to call that phone, often there'd be no answer, and I managed to get the number of the nursing station. And the nurses would say, you know, that person doesn't want to talk to anyone right now. And when I would finally get a hold of the patient, they would say, you know, no, I've been waiting on your call. I was never told that you called. So it seems like asking the hospital to kind of self-report on that, it might be helpful to maybe do some sort of, like Malika said, like a quality check, like try to reach a patient, you know, and see if you can, or, you know, somehow verify whether people are accessible.
You know, I mean, I can go hospital by hospital, you know, like at the Vermont Psychiatric Care Hospital, patients can use the library computers during designated times. and have access to email and social media sites. Patients have Skype meetings with remote providers, peers and families which use VPCH computers. Nurses can take the computers to and from meetings and can arrange times outside of designated times for these meetings. At UVM Medical Center and Central Vermont Medical Center, patients use their own personal devices to stay in contact with family members, supports, and advocates. For patients who do not have their own personal device, staff support them in using a unit tablet computer or unit computer. At the VA Medical Center, patients can use the phone or something called VA Video Connect to communicate with family members, supports, and advocates. There are provisions for privacy in using devices, and the hospital as a whole is working to provide, the VA system as a whole is working to provide all patients with means for remote access, including outpatients.
I really appreciate outlining those protocols. Is there anything being done to just verify the efficacy or accessibility of those procedures?
I guess what I fall back on is that we haven't had any reports or complaints about access.
Tom, I have to stop you right there because this committee has said numerous times that there are concerns and complaints that we have heard about.
And I'm getting it directly from patients myself when I'm at groups in Vermont Psychiatric Care Hospital, Tom.
Yeah,
there is a disconnect, I think, from what you're hearing and what top data what we're getting from.
Follow up on them because if that would be really helpful. So if you can send me an email with a specific example at a facility and a type of interaction or communication that didn't happen, that was difficult, that was complicated, that is a complaint, then I'm happy to follow up on it.
I don't think that is the next step that makes the most sense to me, because we're a small group of people. We might hear about one or two things, but that is not representative necessarily of of the whole picture. So I think DMH has a responsibility to actually check and see what's happening. And what I heard you describe, what the reports that you got from the hospitals does not sound like confidential access to me. Use of a computer in a library or a phone in the hallway, and all I've heard about what privacy looks like is that there are provisions for privacy, but no idea what that means. So I think we just need to have more clarity about what that looks like. And I guess I'm confused about why that feels like a big task or a big challenge. And it might be that it's not an appropriate task for the DMH medical director to do, because I imagine you have a lot of things on your plate, but it is a task that DMH should be doing.
So I can go back to them and ask what their provisions for privacy and confidentiality are in use of devices.
Yeah, that'd be awesome. Thank you so much.
I would say that asking hospitals to self-report what their policies are, and then assuming that those policies are being enacted, that they're effective, and that they're being, kind of provided for equitably, is a lot of assumption to make. It seems like it wouldn't be that difficult to take some sort of step to verify what, proactively verify, what patients' actual experiences are, rather than putting it on the patient to go through the grievance procedure and the appeal procedure and then find the right person to contact at DMH to kind of self-organize and self-report. It seems like maybe just taking a look and seeing what's actually going on in terms of access to communication.
Okay, I can talk with our quality team about that.
I kind of wanted to double back to the report on racial responsiveness. I don't want that to get lost because it's also a very important issue. It seems to me like one of the first steps towards changing racial inequalities is to identify what inequalities exist. What is DMH doing to identify, monitor, and document disparities regarding race?
think one of the first things we're doing is looking at the data that we have and the data we've collected, and to see where there may be racial disparities, and probably more importantly, seeing what data we wish we had and don't actually have, and then moving forward, making sure that we're collecting that data. So for example, if a particular requirement for submission of data may include race, or ethnicity, but it may not be, one of the required fields. So making that something that is required, so we have that data moving forward, would be important.
Would there be any way for our committee to get that data on what is being collected, what disparities have been identified, and what data is lacking?
Did we have information on that was sent by Cindy, or was that?
Yeah, Cindy sent information to the racial inequity group. I will put that down as a request from the committee to know what kinds of data is being collected and what kind of data we're hoping to collect in the future.
Yes, that'd be good. I think nationwide, people who are non-white are more likely to have an involuntary hospitalization, and I think even the data at VPCH suggests that the people who have been treated at VPCH since it's been open, there's been a higher percentage of non-white people treated there than exist in the general population in Vermont. We're also looking at information from the designated agencies in a similar way. I think this is also kind of this is in part of the Vision 2020 plan, and I think, as with the committee, I think also with DMH, I think there's some increased focus and sense of urgency on this too. So we have a committee that's meeting every couple of weeks now, but the committee membership is still growing, and we're looking at, I think we're trying to ask ourselves maybe the same questions that you guys are probably thinking about. What information do we have? What are we doing already? What can we do more of? What might be our blind spots? So this is really an evolving topic for us.
Yeah, I appreciate that work and glad that committee has been formed. And I'm wondering if there would be an openness to including a liaison or representative from each of the standing committees.
We can certainly ask them.
Awesome. And I don't know, you all might have some of these resources anyway, but I'd like to offer to send to DMH and to this committee a list of resources that I've compiled that are about, they're mostly articles, books, and some other resources about the history and current reality of sort of collusion between psychiatry and social work and white supremacy. So that as we're engaging in this really important work, we are informed by the history, the intertwined history of those institutions and current practices, and that we are reading the important critical literature by people of color about this topic.
Yeah, I think that would be really helpful if you can send that along, please.
Absolutely.
Tom, this is Dan again. I want to go back to the issue of police. I think you mentioned under the context of police defunding, and I think what I heard, and correct me if I'm wrong, is the governor is not supporting reallocating police funds to mental health, and DMH is standing behind the governor in that position.
I think the DMH, I don't know how to phrase it, but yes, I mean, I believe we work with the governor and to support his, policies. I think what he was saying was he was not supporting moving funds from the police into mental health services, but rather supporting reforms in the police and adding funding for mental health services related to policing.
This is Vicki. Has the governor changed his official guidelines? That I think that the governor came out with a document on his recommendations for the budget, I think back in March, that was advocating for, increasing funds to the police. And I'm just wondering if any of those have been amended or changed due to, current climate.
Yeah, I'm just going off a WCAX interview he did in June, and that's where I'm getting my information.
Okay, thank you.
Kate, you're mute.
Sorry. Thanks, Dan. Yes, this is Kate. I'm wondering, has there been any discussion about maybe increasing collaboration between police and mental health, aside from maybe budget issues, but in terms of it, I guess I'll just leave it at that. Curious. Is DMH being active? I guess I'm wondering, is DMH... Go ahead, I'll stop.
So there was a piece in the legislation that was recently signed and passed that basically ordered the Commissioner of the Department of Public Safety to work with the Commissioner of Department of Mental Health to propose plans for increased mental health providers within state police works, within the Department of Public Safety. So we had an initial meeting with Commissioner Sherling, and I forget and Colonel Binghamton, I believe, from Vermont State Police, along with Commissioner Squirrel and myself, to start that conversation about what that potentially could look like, looking at different models, everything from community outreach type models that work closely with law enforcement versus actual embedded folks from designated agencies that are embedded within, police barracks, to mental health providers that may actually just work and be a Department of Public Safety employee. So looking at various models, but that's a task that has been given to the Commissioner of Department of Public Safety, and we have started those conversations. And I apologize, but I do have to drop off for 2 o'clock. All the supposed to be done. But I just wanted to get that in.
Thank you. We also need to move on to our next order of business. But someone was saying something.
Malaika, you are right on. I was just, this is Eva. I was just letting you know that Shannon Thompson is on the call, who is the financial director here at DMH, and ready for the next medium item when you're ready.
All right, great. Thank you so much. I acknowledge that other folks might have more questions for DMH, and I would encourage you to write those down and not let those be lost, and we'll figure out a way to maybe they could be in the next update.
Okay. I'm also going to log off now too. This is Tom. Thank you so much for having me.
Thank you.
Thank you, Tom. Appreciate everything.
Shannon, thank you so much for joining us. I think you can have the floor.
Oh, well, you're welcome. Thank you for having me. So I first have to apologize because I have just, we have just been crushed with our budget exercises and deadlines. So unfortunately, I don't have a lot of detailed information for you today. And I think I'd also like to really understand exactly what type of information you are looking for. So what I'm prepared to talk about today is what we do at DMH. And again, I don't have a whole lot of time, so my apologies. I do have a submission due tomorrow. So I'd like to just talk at a high level about what we do, collect, and see if that's what you're looking for and what you might need for more detailed information. Is that okay?
Mm-hmm. Sure.
Go for it.
Okay, so I'm not sure how much you know about what we collect for the designated agencies, but we do collect their monthly financials through an electronic financial system. And we do update quarterly key performance indicators. As you know, cash on hand is one of them. And with cash on hand, and that's the one that I understand that you're most interested in, cash on hand, we do recommend at least 60 days. That's not a lot, but it is. We want to make sure that they at least have 60 days worth of cash on hand. Unfortunately, not all of them do. So the report that I was looking at that probably most represents their cash on hand is an average cash on hand of about 42.93 days. So as I mentioned, some of the agencies are above and some are below, but the majority of them run around the, let's see, I'm sorry, I just got an email that went over my spreadsheet. In the, anywhere from the 30 to 60-day range, a couple fall below, 3 of them fall below that range, but that's kind of the range that they're in. And we're doing, we've done some things to try to improve that. And over the last 5 years, we have seen an improvement every year. So, and the size of the agency doesn't appear to correlate to the days of cash on hand. So it doesn't seem to be that the bigger the agency, the more cash on hand, or vice versa. So I'm not sure if that's what you're looking for, or if you have any questions around that.
Yeah, thank you so much. This is already helpful. So this was my question from many months ago, and I'm interested in the lower end. Like what you said, there are 3 who fall below the 30 to 60 day range. Could you give any more specifics about that?
Yeah, what I think I'd like to do, and again, I didn't have an opportunity to provide you with a report. Let's see, I can look at the preliminary information. It looks like HCRS, Lamoille, and Washington fall below.
Mm-hmm. And about about how far below? Like, what's the lower? Like, can you be more specific about the numbers?
Yeah. So when you said fall below, when I was saying there were about 3 agencies that fall below what I meant was below the 30-day range. Right. So yeah. So I'm sorry. Could you repeat your question again?
How many days of how many cash days on hand do those agencies have?
From between 13 and 17.46 days.
Okay. Okay, great. And do you have similar data for the designated hospitals?
I do not.
Okay.
I do not.
Okay. Great. Well, that's the info I was looking for. That's really helpful. Thank you so much.
Oh, you're welcome.
Oh, I guess I maybe have one other follow-up question. Has there been any financial assistance from DMH or the state specifically for those DAs which are on the lower end of cash days on hand?
Well, we don't provide specific financial assistance for days cash on hand. What we've done is we've instituted a mental health case rate that I think has improved their cash because it's a prospective payment system. But we do not. We have not issued anything specific to designated agencies due to their cash on hand.
Okay, and
it would be a conversation
for all the agencies, regardless of their financial standing, or is it different for those agencies?
I'm sorry. What was the first? I missed the first part.
Is the mental health case rate, is that the same for all the DAs, or is it different depending on their financial status?
It's the same for every DA.
It's the same?
Mm-hmm.
Okay. And can you give us any info? If you can't, that's okay. You might not be the right person to ask, but the retreat, I remember hearing that one of the reasons for a previous sort of cash infusion to the retreat was that they had only 30 days cash on hand. Can you give us an overview of when the retreat or other hospitals have gotten an influx of cash from DMH or the state to support them financially due to, having some financial struggle?
Yeah, so I actually had reached out to the Agency of Human Services because we wouldn't necessarily be the only ones to give cash infusions. It happens it has happened at the AHS level, and I'm remembering twice over the last 5 years. But in addition to that, we've given them recent funding due to COVID and other pressures. So I would say that's 3 times. But again, I've reached out to AHS to get final response on that. And I'd like to go back to my answer on the mental health case rate. When you asked me if they all get the same, were you asking me if they all get the same rate or if the methodology is the same?
Rate.
The rates are not the same. The rates are not the same, and it's not dependent on the size. It's just it was dependent on the funding and services that they're providing. So I guess it's mostly based on what they were allowed to bill for their fee for service. So in that case, it would be based on rates, but not every DA has the same case rate per individual. I don't know if that makes sense.
I see. I guess the thing that I'm trying to understand is because those 3 designated agencies have a lower amount of cash on hand, do they get a higher rate basically to compensate for their lack of cash on hand?
No.
Okay.
That did not drive their case rate. No.
Okay. Great.
Okay.
This is Dan. Is there some corrective action if the cash on hand dips below some threshold and point in time or for some number of fiscal period, months or fiscal periods?
So we haven't. I don't know the level of detail on what our designation. If there's anything in the designation, we don't in the business office have any corrective action for that. I mean, it would obviously be a conversation if they were not able to meet certain obligations. We haven't had to have those conversations with the designated agencies at this point. We just are, very aware and in constant communication with them. So I would hope that, that they would reach out if obligations were not able to be met within their cash. But we do not have any specific requests around that.
And another question I have that you may or may not have the answer to is there any reason why I know you said the amount of cash on hand for DAs doesn't correlate to their size. Is there a reason that you're aware of, objectively from a financial lens, that a hospital would require a different level of cash on hand in order to function? Or is the recommendation for 60 days the same for hospitals?
Unfortunately, I do not know that. I don't know what the recommendation is for hospitals.
Okay, that's fine. Thank you.
Okay.
Cool. And you, where did you say you had? I think you said that you'd asked for information about cash infusion payments to the retreat over the last 5 years. Where is that information ultimately coming from?
Well, I've reached out to Agency of Human Services just to verify my information. So if it's any
Okay.
different than that, if it's different than that, I will let Eva and Jessica Bernard know that so that they can reach out to you.
Okay, perfect. Yeah, if it's more than twice in the last 5 years besides this recent COVID-specific funding. And also it'd be great to have those amounts. I'm sure that I could dig them up somewhere through, like, I don't know, Vermont Digger or something, but I'm sure that's easily accessible information for AHS.
Yeah, I'll when I hear back from them, I'll try to get that information as well.
Okay. Thank you so much. I really appreciate it.
You're welcome.
Any other committee members have questions?
Nope.
Good.
All right. Well, thank you again.
Appreciate your time.
Thank you, Shannon.
You're welcome.
Okay, looking at our agenda, we have a number of items of business that we haven't gotten to yet. Let's do a membership update really quick. That's listed first.
Yeah, I can give an update on membership. Marla and I had an offline meeting, and what we've done is we've divided up the list of past members and are making phone calls to them, doing exit interviews to find out, more about their experience on the committee. And we've also allocated between the two of us the prospective members, and we'll be making calls to them as well, just to touch base and see if there are any questions or we can provide any background. Eva, very generously put together the list of all these individuals, and I'd like to share that with the entire committee to make sure everyone's on board with who's on that list, and if there are any additions that they can supply that to Marla and I.
Okay, great. Thank you. Cool.
Dan, will you
I know
be?
we also have. Oh, sorry. Go ahead.
Dan, will you be sharing that, or do you want me to share that?
Let's talk about that offline, Eva.
Okay.
Yeah.
Great. I know we also have some other larger membership discussions to have, like the issue of 3 members from one organization and the membership subcommittee process. But so today was.
Sorry, Malika, I missed the beginning of that. You cut out for a second.
There's also an agenda item about like membership discussion that's like including the subcommittee process and the issue of potentially 3 members from one organization. But it seems to me that we have some other possibly more pressing items to get to first. So are folks okay with me just going down the list in the order of most urgent from my point of view, or?
Go for it.
Okay.
I'm okay with that.
Okay, great. So, listening session. Dan, I think you have an update for us, right?
Yeah, I actually, yesterday I was finally able to sit down and put together a summary of the discussions and feedback I've been getting from different entities. Honestly, I'm going to take full responsibility for being the bottleneck with this and not moving forward. But I would like to recommend, I can pull that out, Malika, and go through it. I'm not sure. I guess my recommendation is that we form, if we haven't already, or maybe it's reinforce a committee structure to move forward on this, and put a little bit more accountability into the process and make it happen. So yeah, to Michael, I guess I'll throw it back to you. What would you like to hear?
Yeah, I mean, I guess I do have your summary in front of me. I think that recommendation is a good one of forming like more officially a committee. I think it's felt like a barrier to not be able to like get people together outside of this meeting time, which is so crunched. So I know it's important that we follow like the open meeting guidelines, but maybe DMH could help us understand how do we have a committee so that we can just get the work done that needs to get done outside of this, and yeah, that maybe is a starting place.
Jess, correct me if I'm wrong. So work that happens for the committee needs to be able to be public. So if this committee said they're going to have a different meeting time about work that they want to do, all members would need to be notified of when that would be, and public would need to be notified of when that would be, and there would need to be an agenda for it? Or could it just happen because it's a between meeting process?
Yeah, you could treat it like a subcommittee the way I think you do with membership. So if you wanted to have meetings at, the time that additional meetings that work for the most people who are going to be involved, what you would want to do to still stick with public meeting law is any decisions or votes would really need to happen still in the public domain. So you could use the subcommittee to create recommendations that come up with a process that you want to recommend the whole group adopt. And then that way you bring the update and you bring the measures to the full group and you discuss it. And then if you wanted to vote or adopt something, you would still be within your public meeting law parameters.
So Jessica, is there any reason using the process you just mentioned that the subcommittee could then send around an email to the entire committee to get decisions made so that we can get things done have decisions made between meetings, and that correspondence would become part of the public record?
You can't vote in between meetings. So just like with your subcommittee for a membership, you can do all of the, the reviews and you can do all the legwork, but then you do have to bring it to the committee for the final vote or recommendation. So the subcommittee for this item would really need to function the same way. You can't do votes over email.
But if they've already had a decision by the group to say they want to have the listening session, what sorts of things would need to still be voted on beyond? Like, could they hold it then?
Yeah. Oh, yeah. Meetings? I mean, there's no reason you can't go forward with the subcommittee. I think you would just want to be conscious that if something came up where you had two members feeling one way, two members feeling another, and you couldn't kind of come to an agreement about something, you felt like you needed to vote on something, that would be something you would just need to do if it were a bigger item that the whole group needs to approve. Something like that needs to just go to an update and a vote for the big group. But yeah, I mean, there's no reason you can't move forward with this subcommittee.
Thank you.
I have a question. I understand that this is the protocol for subcommittees. I'm just curious, given that we're such a small group, it seems like the parameters are that committee meetings need to be open to the public and the public needs to be notified. And it seems like currently the way the public's notified is just by posting on the DMH website. Given that our meetings are all, Zoom meetings and remote meetings right now, if we wanted to, speak about something, it seems like we would just post on the DMH website the day and time that we're going to get together and speak about it, and that would be fulfilling all the would that be fulfilling the criteria for the public meeting law?
You could. So a group can decide how often they want to meet. If you need to increase your rate of meeting, I think the only thing that we might potentially run into is that from a DMH admin support side, we may not have the capability to meet more. So if you all would then, we'd have to discuss if you were comfortable taking your own notes, recording the meeting, if you're recording it, how we would get that recording posted. Yeah, so I feel like if you all are talking about you want to meet more often, that is definitely something that you have the ability to do. I think if you are looking for DMH admin support, that's just where we might get into a little bit of not being available.
I'm really not talking about increasing frequency of meetings. I don't think anyone is advocating for that. I'm just saying if we have issues that we're not able to get through in a monthly meeting, if we want to call an extra meeting to just decide a specific issue, do we need to form a new subcommittee to do that, or can we just call another Zoom meeting?
Like an additional ad hoc meeting rather than in a general way increasing the frequency.
Exactly.
Mm-hmm. Yeah, I mean, groups can call special meetings if you want to call it that. If you think that that's a better fit than a subcommittee, depending on what your topic is and how often you're going to need to meet.
Thank you. Yeah, I wasn't suggesting it. I was just curious about the options. So thank you. That's very helpful.
Malika?
Sounds like we have a number of paths forward. Does anyone have a suggestion? It makes sense to me we would want to meet outside of this time in some way or another.
Micah, this is Dan. Can you hear me?
I can now, yeah.
Yeah. I don't know if you're aware, but I just lost connection, so I missed the last several minutes of what was being said. Just FYI. So.
Okay. We were just learning from Jessica about the different options for having a meeting outside of this one, and it sounds like we can have a subcommittee and not have like official open public meetings as long as we're not making significant decisions that would require the whole group to weigh in on. We can sort of do the grunt work there, and also we can schedule more frequent meetings or just an ad hoc special meeting in addition that is open to the public and follows that whole protocol. So those are the options, I think, in front of us.
Thank you.
Well, I guess I will suggest, if no one else has a suggestion, that we figure out first who's interested in being part of, doing sort of the grunt work of figuring this out in either subcommittee or ad hoc meeting. Who would want to do that?
This is Ward. I'll volunteer to be part of that.
I'll continue to be involved, but I would just as soon not be the one leading the process.
Sure.
This is Vicki. I'm available to help. However, I just haven't, I've been out for a while. So, but if there's Ward, if you need any support or any help, just let me know.
Okay. Yeah, I think I talked to Dan. If you want, I can try to coordinate things and pull people together on this.
I definitely want to be a part of the actual listening session anywhere where I can help out.
Good.
Prior to with logistics.
I think that what I would propose to do is that we'll have some people working on it, but if we want, we can allow our emails just to be open to the whole group.
I was going to request that, yeah.
Yeah, and that so you can follow along, you can understand where we're going, and it's really the whole group doing it, but obviously everyone doesn't need to spend a lot of time because we have a lot of things we all want to do.
what I was meaning is if there's any kind of groundwork that I can do logistically, then I would be able to help out.
All right.
So.
Cool. And yeah, I would love to be involved. Yeah, I think email is good for a lot of us, and I know Marla has been really clear that email doesn't really work well for her. So maybe after this meeting, if someone would be willing to volunteer to give Marla a call and let her know about whatever we come up with, and so that she knows that we are going to be emailing about it, but that there's no pressure to sort of keep up with those.
Yeah.
Cool. So it sounds like we can just schedule something with those of us who want to be at this other meeting, and yeah, we might as well just do that over email and keep everyone in the loop about when that is, and whoever is able to can come. Does that sound good to folks?
Yeah.
I guess I would make this a subcommittee.
Yeah. Malika?
Yeah.
Malika?
Yes?
Oh, I just wanted to summarize the fact that I have gathered a lot of information and deep suggestions and so forth. So yeah, so I have a lot of input to offer. But I think it'd be great if we have a group of people offline working on it together collaboratively.
I agree, and very, very much appreciate the information gathering and networking that you've done about this. I think that's going to set us up to be able to, move forward in a pretty actionful way. And also, I'm remembering Laura's comment earlier about DMH's role in this, and absolutely one of the, orders of business will be to figure out what support we need from DMH to make this possible. And I know that a lot of people on this committee are doing this work like totally on a volunteer basis, so don't want to overtax or over-rely on people's unpaid labor. That's not cool.
If I can comment on what a lot of the legwork that Dan did, and my feeling is that we found out that what this committee is trying to do with this listening tour is unique, and it's not really redundant to what others are doing. So I think that's an important, that we did do our legwork to know we're not just doubling up on something.
Yep. Yeah,
that's awesome.
Yep, and that some of the other things going on complement what we're doing.
Right.
And that if we all communicate with each other, everyone will be better off, including the Vermonters who have mental health conditions.
Yeah. And we can acknowledge that DMH has done an action that they were given, which was providing contact points within the hospitals.
Yep.
So.
Yes, that's very, very helpful and appreciated. Thank you for noting that. Ward, would you be willing after this meeting or even now to send out an email just around scheduling? It might be useful to do a doodle poll.
Yep.
We can get something on the books soon.
All right, that sounds good.
Sorry, I missed the logistic. Are you expecting people to put forth what sort of capacity they may be able to help with now, or to do so at the committee meeting?
What I plan to do, Bert, is to take a little bit of a stab at what I think some of the things are we need to think about.
Okay.
Just so we have a list, and then we can have a doodle poll and get together, and we'll probably need to add to that list or at least understand it, and then we can, divvy up the actions as to who's going to do what at that meeting.
Okay.
Thank you, Ward, for taking this up. I really appreciate it.
Yeah, awesome. Okay, to move on to the next topic?
Yes.
Okay, I'm going to. So we have this outstanding letter that Vicki originally drafted, that we've reviewed a few times, people have given input on, there's been edits, and we've never finally just voted to send it. So that's on our agenda. I believe we plan to vote on that at this meeting. Is there any discussion that we need to have before voting on it, or do people need to have re-emailed the letter?
I'm good.
I'm good.
I feel very well prepared for a vote, yes.
Good, let's do it.
I've been out for 3 months, so I haven't seen the most current version of the letter. But if it's mostly the same, I'll vote on it. I don't want to delay a vote.
Yeah, I think you need to move it.
I think, Eva, correct me if I'm wrong, or anyone else, but I believe that the most recent letter is the one that you, Vicki, most recently edited. I don't think there's been any changes since then.
Oh, okay, thank you.
Yeah, that's my understanding too.
Mm-hmm.
Then I'm fine going ahead to vote.
Yeah, and that was absolutely awesome job, Vicki.
Thank you.
One question, Micah, is that letter's addressed to Sarah, the commissioner?
I believe so. I might also be Fox, but I'm not sure.
Okay. Do we want to copy anybody else, like maybe the Sarah's boss, the head of the AHS?
Is there a reason to elevate it at this point? I mean,
probably not. Just,
Yeah, I think that's maybe not necessary, but
yeah.
I think it would be only fair to Sarah and Fox and their shared duties that we send it to both of them.
Yeah.
Okay.
That sounds good.
Yeah, Dan, I really appreciate that idea, and I do think that there's a place for that, and I'm not opposed to it even being in this letter, but I think I would also be okay with just sending it to them at this time and seeing what kind of response we get. And then, we're just remembering that we can access those folks if we need to.
Right.
Yeah, that's not fine. That's fine. I wasn't recommending it. I was just throwing out an idea.
No, I think it's good. The other thing that did occur to me, and I don't want this to delay the process, so I'm sort of in favor of just passing this through, but there's been issues also that have come up since we drafted that letter, particularly around the inconsistency, the issues that we've talked about around DMH updates. But I'm personally in favor of just sort of addressing that in a separate process, just so that we can not delay this further. But if anyone feels differently, speak up.
This is Vicki. My original intent in drafting the letter was just to lay down, to clarify exactly what the processes and rules and what our duties are. And that way, if we have any issues with meeting them, then that would lay a foundation for further discussions. But when I was drafting the letter, I wasn't really having in mind necessarily protesting anything or disagreeing with anything so much as just clarifying kind of what the standards and duties are. So I think, as Dan kind of mentioned, if we want to create a letter that goes to a broader audience, goes to more people, kind of stating positions, that would be, fine for the future. But this one being more just for, I think asking the commissioner and deputy commissioner sort of to clarify our role would be adequate for the scope of one letter.
Agreed.
Can I make a motion to approve the letter to be sent to Commissioner Sarah Squirrel?
I can second that.
Great. All in favor?
Aye.
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 Any opposed? Any abstentions? All right, we've agreed to send the letter.
I don't know about anybody else. I'm having a hard time hearing Malika.
Yeah.
Okay.
Oh, I may have been covering up my microphone. Is this better?
Yes.
Yep.
Oh, so sorry. Thank you.
No worries.
Okay, great. So we've approved the letter. Maybe Vicki and Eva, you can just make sure that you all have the same up-to-date copy, and then Eva can submit it on our behalf, or do we need to actually send a physical copy?
I think sending a physical copy and electronic copy is just good process, but that's just me.
That sounds pretty good.
Mm-hmm.
Does anyone want to
Are we
volunteer?
sending? I'll go ahead and do that. Can I put that we all, everyone at this meeting signs on to it?
Yeah, I think
I
you
can
say
call
it's on
Marla
behalf
and
of
ask
the
if she
committee.
signs on. Okay, so we don't need to put individual names.
I don't think so, personally.
Yeah, that's fine. I wasn't sure. And we're sending it to the commissioner and the deputy commissioner?
Yeah, we didn't include that specifically in the motion, but I don't see why not.
I would amend the motion accordingly to go to both.
And I can second that as well.
All in favor?
Aye.
Aye.
Opposed? Abstentions? Great. Okay. We're being very productive today. Moving on.
Yay.
Under your leadership, Malika.
Maybe it's better to be on the phone. I don't know. Okay, we have grievance and appeal data to look at, but I feel that we don't have time to do that justice today. So I think if people can just make note of that to review for our next meeting, and we can include it on the agenda then.
I for one agree, because I have a lot of issues I want to talk about related to that.
Yeah, there's a lot to talk about, for sure. Do any members have any issues that they want to prioritize for the last couple minutes before we talk about our next month's agenda?
This is Ward. Do we want to talk at all about the secure residential discussion, the new building project?
Oh gosh, yeah, that's a good idea.
I agree. I was recalling actually a little bit Thelma's email about bathrooms, but maybe not bathrooms with a shower. Do we have someone who's officially a part of that committee?
Well, I attended the last meeting.
There is such a thing as being officially part of it, but there were a couple of us who were there.
Okay. Yeah. Well, in that case, I'd like to have an update. I'm only just one person here, not meaning to. Right.
Yeah, I can also email an update that I wrote out. I just took notes, and so I could forward that to the committee.
Sounds like a good plan to me.
Mm-hmm. Maybe if you can forward that to us, maybe we could respond with the specific concerns we have so that we kind of have a structure to go off, because I think this will be a very involved conversation for our next meeting. Maybe we can just kind of contribute which particular topics kind of caught our interest as wanting more information about.
Mm-hmm. Yeah, absolutely. And I had asked Eva for follow-up from Fox, who I think was out and maybe not available, but Fox said there was some data requested by that group, and Fox said that he would send it out, but that hasn't come out yet. So that should be passed along, as well as the recording of the meeting. The meeting didn't begin being recorded until halfway through, unfortunately, but the recording that exists should be shared, I believe. Is that possible, Eva?
Yes, I have sent both those requests to him, and I will make sure they get sent to the whole committee when he has a response.
I may have a recording of the first half of the meeting. I was only there for the first half, and my phone takes really poor quality recordings, but I have some memory issues, so I do tend to record things. I can look into that.
Excuse me just a sec. I dropped off. This is Dan. Are you still talking about the residential issue?
Yes.
Yes.
Thank you.
That's awesome, Vicki. That sounds like valuable if you want to or able to share that with people who aren't able to make it. It does seem like a thing that this committee should be concerned with. So, yeah, thanks, Ward, for bringing that up.
This is Kate. Can I have a comment to pass along. Going back to the updates when they're provided, and we talked a little bit about asking, the format of those updates and maybe getting an idea of what the update would consist of in advance of this meeting, which I think would be great. And I was wondering, part of me has been wondering, is that something to put on the open items agenda, as Dan was suggesting, which I think is a really good idea, just to have that running list. And I guess what I was wondering about was, would it make sense to ask DMH to provide just sort of, a list of the topics, at least, that they plan to update us on, and maybe to email that a couple of days ahead so we can think about it, and yet that it's still pretty current with what they're actually going to talk about, at the meeting. And maybe we refine, see how that goes, and maybe refine it further as needed, something like that.
Yeah, thanks for bringing those up. Those are two things we need to touch base about before we end, creating that action list and, some ideas around what an update should look like. And I really like your ideas, Kate, and would love for us to be also generating, what we would like to see on that agenda.
I agree. I think it's sort of a two-way thing. I think I'm not sure if it was Lori or Lynn, someone who mentioned that we don't always know what to ask about to update, that they should sort of let us know, here's what's happening, that they should be updating us. But also there should be a bit, maybe two-way, where we can ask to be updated about certain things. But, maybe we don't have that all ironed out now, but I think those are things that are worthwhile to iron out, and maybe we figure out what we want to say about this upcoming meeting, how to update in the meantime.
I agree, Kate. I think that would be an important logistic to engage in. It might mean doing a few extra emails and doing a little bit of legwork, but I think it would be an important way to ensure that we have a more robust sort of modality of communication between the DMH and the committee.
Perhaps to start with, for our next meeting, if we ask anyone who's presenting if we might have a list of just sort of, just a little their own agenda for what they're going to present. Maybe even if we just start there for the coming meeting, we can see how that goes, and it gives us time to tweak our thoughts a bit more. Just a thought.
I think that's a good next step, and hopefully that will allow for a little bit more communication, sort of in a two-way. Right.
And this is Vicki. Just two quick things. Kate, that's a specific request that I've been making for over a year, that we could just maybe get an update just even a couple days in advance on who's going to be speaking in the general topics covered or the general statutes. And I haven't, that really hasn't come to fruition yet, but it seems like an issue that's fairly significant. It might be helpful for us to put that in writing, to make it kind of an official request. I don't know, but my other thought was just, I'm a big fan of organization, just because I have a really poor memory. So I really liked Dan's idea of the kind of open items document. And I was wondering if maybe we could have, I think I brought this up earlier, but I could set up a shared drive so we could have a document for open items, a document of open requests to DMH, committee recommendations, things like that, so that we have sort of one place to go to kind of keep these documents updated on an ongoing way. I know with having email lists with attachments, I have some trouble locating some of those sometimes, and I was wondering what committee members think about having a shared drive.
I'm giving you a resounding yes. I like that idea. That would work really well for me personally.
I would be happy to make a mock-up for us to just look over and discuss at our next monthly meeting, and then we can make whatever changes work for committee members.
Yeah, Vicki, I think that's a really good idea. At the same time, we do need to be mindful that not everybody has the same level of technology device ability to access that. So, yeah, I think it's a good idea. We just need to be thoughtful about how we implement it so we make sure we're inclusive of the whole committee.
Agreed.
I agree.
That's a good point.
This is Eva. Thank you for that. I've heard multiple times folks mentioning inclusiveness for the whole group, and I really appreciate that. Vicki, I just want to note that I haven't heard you previously ask for the topics to be shared for the next meeting or who would be leading the update, so I apologize if I haven't included that because I haven't heard you state that before. But I have listed that on my follow-up document, and so going forward, I'm going to try to be more on that when we share the agendas to include who we think will be leading the update and what the topics will be. Generally, folks at DMH are really liking it if topics are given by members, if there are things that you do want updates about, if those can be shared previously so that we can do some prep work on that and have it ready for you. So if there are things that you would like to hear about, I try to keep a list as the meeting is going about what follow-up items you have. But if there's anything specific that you have, I would love to know about it. Thanks.
I realize I did not mean to imply that you hadn't followed up on that. I think I first made a request when I first started, and I don't think you were leading the first couple meetings I attended, and I think I followed up.
Who's talking?
I'm not hearing that.
I can't hear you.
Me neither.
I'm sorry, I must not have a good connection. I was just saying that I apologize to Eva. I wasn't meaning to imply that they had not followed up. I think I made requests 2 times. I think both times were not meetings that Eva was at.
What do we think about moving forward with the Google Doc thing and accessibility for everyone?
I think it's a great idea. I think we should make a motion and try to consider what viable next steps might be.
Is there anyone for whom that would not be accessible? I also know that Marla isn't here. I think Thelma's not here also, so I'm not sure whether that would work for them or not. I also don't know if, it might be acceptable if it's not something that everyone wants to use or can use, and if those who want to use it do, and then, maybe Eva or someone in advance of the meeting just sends out the most recent, like a static version of the Google Doc or something downloaded and sent an email to everyone to review.
I could do that.
Okay.
And I would just suggest that we, rather than making a motion, that I would just research what platform would be easiest to use and create something for us to look at and then make a motion to vote on it at the next meeting, because I don't want to I don't want us to vote on something we haven't seen yet. There might be issues and feedback that people have that we can't anticipate till we're kind of looking at what would be created.
Yeah, I think that makes sense. And we should probably think of it in terms of a trial, doing something on a trial basis.
Yeah.
Yeah.
That makes good sense. I not mean to assume that everyone was technologically capable of doing this, considering the resources they have available and the ability to do so. So I wasn't meaning to push for this idea, but I think it could be a good thing.
Eva, this is Ward. Does DMH have any place that we could do this on their servers so that the data stays within DMH and for posterity, so to speak?
You can share documents with me, and I can have them posted to the State Program Standing Committee webpage on the website. But if there are things that you think will be updated like more than once a week, then it would be better to have it owned by y'all.
Okay, but you could be a repository for any real important stuff that we want.
Absolutely.
Sure.
Anything you want posted on that site, I can do, or if you want it housed within DMH, we have a set of files that's just the standing committee. So like, draft minutes are there, or agendas or stuff are there. So if you want it stored there, definitely we can put it there. It's just not visible to folks outside of DMH until it's emailed out.
Yeah. Okay. We'll continue on.
I feel like we have had this discussion, at least in part, before, and that anything that, at least I feel that anything that ends up on our website should probably be posted through some sort of vote, and then of course I'm grateful for Eva's leadership and offering to do that. So.
And I'm going to just jump in. It's 2:59, so I would like to have an opportunity to talk about next month. DMH's quality processes are restarting, and so that means that in order to stay on track with the hopeful timeline, you would need to review CSAC documents at the August meeting. And so if you want an hour to be able to do that, then there's kind of a time crunch of other things that can happen outside of that. And so if you look at the August draft agenda at the bottom of this agenda, 2:15 to 2:45, there's a half-hour chunk, and you could either use that to talk about inviting Allison Cromp back to talk about suicide initiatives that are happening at DMH, or you could use that for reviewing the aggregate grievance and appeal data or any other things you'd like to put in there. But that's kind of my question is, do you want me to invite Allison back for that time, or would you rather have that time for other things?
I would rather have that time for other things personally, for the grievance and appeals data and other just ongoing business that we've deferred.
Great.
I agree. I don't see a need to revisit information that we've looked at before, considering some of the suicide tools and some of the work that Columbia has done.
So I will just move Allison to a future agenda. I'll leave it open. Great, thank you.
I'd also like to put on an agenda soon as another order of business for the committee that doesn't need to trump any other items, but reimbursement for committee members for time worked on administrative tasks outside of the meetings, such as minutes, and like generally, what is the budget that DMH has, if any, for the standing committees?
I can definitely put that on a future agenda. I can also share that I've followed up on that previously and been told that the stipend that you receive for this time is the reimbursement that's available. And there is another pot of money right now that's set aside for other work time.
Okay, I think there's still a little bit more to talk about, such as, like, those of us who aren't, there's a maximum number of stipends possible that aren't being used. So can some of that be reallocated? Anyway, we can put it on the agenda.
Sure.
So this is Kate. I have a question. Did we leave it, was it Vicki that offered to sort of get us going on Google Docs? Were we going to go ahead and do that and see how it works? Or I'm a little confused on that, how that ended.
This is Vicki. My impression is that I'm just going to do my best to put some stuff up on Google Docs as a starting point for our discussion, and then you guys can tell me what you like, what you don't like, what's accessible, what's not accessible, and it can kind of we can move from there to something that works for everybody. But that by the next meeting, I'll just have something that, well, I'll email you guys, something you can explore and start getting feedback on.
Great. Thank you. Thank you.
Awesome. And this isn't a requirement, but is anyone willing to give Marla a call about some of these things that are going to be happening over email?
I can call her.
Okay, thanks so much, Dan.
Yep.
All right, any other agenda items for next time or changes to the proposed agenda?
So, are we going to do the review of the secure residential next time also, or no?
That's a good.
Or that by
good
email?
Question. I think maybe it makes sense in between this meeting and the next for information to be shared, such as the recording and my little write-up, and anyone else who wants to share things. And then if we can make a little time for it at our next meeting to talk about, you know, whatever we need to talk about it, that might be good. Is that what you were thinking of, Kate?
Yes. Yep.
And is our goal to come up with a position statement or a letter of advisement so that we can kind of make our position on this sort of an official recommendation from the committee?
I don't know if we have a clear goal about that. I have that goal.
I think that's a good thought that we should. Other advocacy groups are setting up and to make positions about that. Some relative to the seclusion and restraint rooms that are being set up, and certainly Malaika, your thoughts on just what is it we're trying to do in this place is a pretty key thought.
And
my
would you also send to the committee for review any other additional input that's come in from the public outside of that meeting space?
I can ask for that.
Yeah.
I know we're over, but I just wanted to clarify. My impression is that this is the first time Vermont is, and I'm really sorry if I'm misunderstanding, this is the first time Vermont is expanding the use of involuntary restraint and seclusion to a residential facility. Does anyone know if that's correct?
Yeah, I believe you're right on that, or at least it's going to take some a significant thought. Dale, I think, needs to chime in or approve of whatever these changes are going to be for seclusion and restraints, should that happen.
Having one's like daily care team have the authority to put one in restraints in long-term, in one's long-term home seems like a very impactful precedent to set.
It's a big deal for sure. And,
it's a big deal.
Need to be on top of it. We're at 3:06. Someone want a motion to adjourn?
I'll motion.
I'll second.
All in favor?
Aye.
Aye.
Opposed?
Aye.
Abstentions?
Thank you.
Very good.